Hello and welcome to Lynchburg Live. I'm your host, Linda Smith. Tonight my guest is Dr. William Andrews. Dr. Andrews is a frequent Lynchburg Live guest because he has a variety of interests and wears many hats. Tonight he will be telling us about his pediatric orthopedic outreach missions in Central and South America with a program called Kids First. Dr. Andrews, it's always a pleasure to have you on my show.
Pleasure to be here.
You were here, I think it was about a year and a half ago, talking about Kids First, and I'm sure that there's some people who didn't see that show, so for those people, can you tell us please what Kids First is?
Certainly. Kids First is a group of doctors and nurses who have been together about 20 years, and we do surgery on children in South and Central America.
How did you become involved?
One of my best friends was involved in some of these trips, and we were talking one day, and I was intrigued, but I must admit I probably wouldn't have done it if my wife hadn't pushed me a little bit. And I did the right thing, which is I did with what my wife told me, and then I became involved, and once you do something like this, it's in your blood and you continue to do it.
Are you one of the founders?
Yes.
Okay, and there are 2 or 3 of you?
2. Actually, I take that back. There are 2 doctors, 2 nurses. There are 4.
Okay. How often do you make your trips?
We do 1 surgical trip a year.
And in 2009, you didn't get to go?
Yes, about 5 days before our trip was due to leave, we'd shipped all our equipment. The H1N1 virus was on a rise, and Mexico was very worried about bringing a lot of people together and transmitting the virus. Mexico gets enough bad press that they really didn't feel they could handle an outbreak of H1N1. So they canceled all medical clinics in the country, and we had to cancel the trip with very little notice.
But you do make these trips annually?
We make the surgical trip every year, and then there are other trips as well.
Tell me how long you stay when you do the surgical trip.
Surgical trip is 10 days.
And then I think you told me that you do a pre-op visit and then you go back later and take care of checking on the kids post-op? Yeah,
so I'll do a pre-op trip where we'll screen children for surgery and see some of the children we've operated on. I'll do a post-op trip 6 weeks after the surgical trip and take all the casts off and examine all the kids. And then I usually do 1 other trip a year because there's a lot of negotiation with the government that has to take place. We have over 100 volunteers that I work with. So there's that extra trip just to get all the logistics done.
You take your full surgical team. How many people?
23.
And what positions do they hold?
We are lucky enough in that we have an entire team. So we have nurses who work in pre-op, nurses who work in the operating room, nurses who work in the recovery room, and then we have 5 anesthesiologists, 3 surgeons, and 2 residents who are surgeons in training at academic places. And
they're from really all over the country, right?
Our team is, yes.
And you don't have new people every year?
No. We have almost no attrition, and our nurses pretty much run the trip. So if there were some attrition, occasionally a woman is pregnant or something, the nurses then replace that person.
It certainly runs more smoothly, I'm sure, with everybody knowing what everybody's likes and dislikes are and how they work.
Oh yes, and as you know from working in the operating room, our team has been together so long that it's much more efficient. All the nurses know exactly how the doctors work, and you can do more surgery if you have an efficient team.
Are you in a partnership with any other missions, or is this totally independent of other missions?
This is completely independent.
What are the benefits of that?
The biggest benefit is that we are nimble and we are totally in control of what we do and where we go. We did, way back, work under an umbrella organization. We were giving to that organization $250 a person, and then they were running some of the aspects of our trip. And we realized we could take that money and be giving it to the children in terms of giving them care. And as well, we could choose the places we wanted to go negotiate all the work with the government. So it was much better for us because we have all our own equipment. We have an entire array of operative equipment and everything. We really didn't need an umbrella organization.
So there are a lot of benefits.
Many, yes.
That really outweigh being involved with another organization.
From our point of view, no question, yes.
What's your current location?
It's in central Mexico in a town called San Miguel de Allende.
Okay, and you've been there for a while.
This will be our 6th or 7th surgical trip.
What made you decide to just locate in one particular place?
We had been in Colombia for a number of years, and Colombia had become actually pretty unsafe. The guerrillas had gotten quite close to where we worked. And the last trip to Colombia, about 2 weeks before we were to arrive, the guerrillas took our hospital over, and we lost a tremendous amount of equipment too. So then we were really trying to find a place that was like Colombia. We had wonderful volunteers in Colombia. There was tremendous need. We loved going there. And we went multiple other places in search of that place. And for completely unrelated reasons, I went to San Miguel once with my wife and some friends. And I met a woman there who runs a rehab center for basically children who don't have any funding. And the more I got to talking to her and thinking this was a piece that we could add to our trip, the more I wanted to move it there. And it took me about 3 years to get all the negotiations done. And it's become a very nice place for us to work with wonderful volunteers, tremendous need from the children, and a very cooperative government.
And the people know you're coming.
Yes.
So I'm sure that that's very helpful. How about your surgical supplies? Where do they come from?
Well, all of our operative equipment we own.
Okay.
So all of that is set, and we from time to time have to replace equipment, but we own all that, and that travels with us as checked luggage. Our what we call durable goods, cast material, sheets for the OR, sponges, all those things that make up an OR, that make up the OR work separate from the operative equipment, we ship. And one of the other advantages of going to Mexico is we ship this overland,
right,
and it saves us about $7,000 or $8,000.
That has to be a big plus
It's a
for
big
you.
plus.
All right. This year, your team made the trip in May.
Yes.
Approximately how many evaluations and surgeries did you do on these children in May?
We probably examined about 200 children, and we did, I think, 140 operations. Some of the children had more than one procedure, so we didn't operate on 140 children, but we did 140 operations.
What kind of deformities and surgical needs do these kids have?
These children have the same needs that children do in our country. The difference is that we only go to places where there's no orthopedic care at all. So these same problems that we would treat at birth are untreated, and they're much more severe. So we see club feet, we see cerebral palsy, we see spina bifida, infections, we see bones that were broken and didn't heal correctly, dislocated hips, brachial palsies, which are birth injuries where the arm doesn't work well, a lot of congenital hand deformities. The same things that we see here, they're just more severe.
And that's just because they're not addressed at the time that they should be.
Correct.
Okay.
And it's always been our goal not to go where there was otherwise care. And so the beauty of that is that you can really help children who wouldn't get any care. Sometimes the sad part is that often their problems are so severe that you can't completely correct them.
We have a lot of visuals. We've got some video, and we've got some pictures that you brought. So Phil, if you'll put those up on the camera, we'll get Dr. Andrews to tell us what they are, please.
Okay, I think this is this the video?
This is the video.
The Mexican government did a video on our team, and it actually was broadcast throughout the country. It was about a 10-minute video. That's Greg Mencio, one of our surgeons. That's Laura Meyer, another surgeon. That's myself there. And it was really, they did a very nice job. We really appreciated what they did. And it mainly serves for us as just another way to get the word out so more children know about us, so more will come.
So on that child, you were doing a pre-op.
Yes, that's the first day we screen the children, so we see about anywhere from 200 to 300 children, and then we decide who's going to have surgery. And this is my room. I'm sitting down there. The room I'm in has 2 cases going simultaneously because of space. And I think we're doing a hand procedure on that child. And that's Greg Vencio from Vanderbilt. This is the area where the children wait before surgery. And that's Judy, who's our recovery room head nurse, who's 71 and still going strong.
Where is she from?
She's from Connecticut, Newington, Connecticut. And that's Young, who's one of our anesthesiologists from Cornell, and that's Ned Stone, who's a resident from a hospital in New York.
You take a new resident?
We take 2 residents a year, one from Vanderbilt and one from somewhere else. That's one of our translators, John. Like I said, we have about 100 volunteers. And that's the post-op area. That's Sylvia, one of our post-op nurses.
I'm guessing that there are a lot more children than you can get to who need help on a trip. How do you handle that?
When we see the children on Sunday, we rate them a simple 1, 2, 3 scale. 1 means has to be done, 2 means if we can, and 3 means they really don't need any surgery. So we try to do all the 1s. If we don't get all the 1s done, then they're first choice for the next year. And we have all our records are all computerized, and we scan pictures of all the kids, so we know when we're coming back who's already on the list.
That child's legs were terrible.
Yeah, that was a bad cerebral palsy patient. A lot of contractures, and that's just some of our equipment you can see there. You recognize the Synthes set.
I do.
And one of the nice things is we've had donated or we've purchased all of our major equipment, which really makes it nice. That's the back hall where we keep the cast and material and everything, and that's just some of the nurses. But we ship about 120 of those boxes down, and that's the things that we use that aren't the permanent OR equipment. And those, whatever is left, we donate to the hospital every year. That's just where we screen the children, and those are 2 of our volunteers. Most of our volunteers have been with us for a long time, which also makes San Miguel a really wonderful place. Because when we come back, we're seeing friends, and they know our system, and it makes it much more simple.
After you do the surgical trip and before you go back for the follow-up trip, who actually sees these kids, or is there someone overseeing their care?
Well, there's a local doctor there named Roberto Maxwell, who is an intensivist trained at San Diego, and he's from San Miguel. He grew up in San Miguel. And he is available for anything that happens that has to be seen right away. There's a man from two hours away in Irapuato named Eugenio de Pavia. Eugenio is an orthopedist, and he has become a good friend, and he will basically see anything that has to be seen between my visits. I go back at 6 weeks and take all the casts off. But that system has worked very well, and because of email and cell phones, if there's ever a question, they can always get me, and we talk on the phone, or he can send a picture, an X-ray on email and stuff.
Phil, you can go on and put the stills up, and we'll talk about those too. Got a lot of visuals.
That's the OR I was talking about. One, we have 2 cases going simultaneously, and the other one would just have 1. There are only 3 ORs in this hospital, and when we're in a hospital, we pretty much take it over. So we leave 1 operating room open for mostly delivery of babies. And one of the interesting things is how the children, once the day is going, the 2 cases never stop at the same time. So we'll have 1 case going, we'll bring another child in, and they're totally trusting, which I think is pretty amazing to walk into an operating room that's working.
That was one of my questions, that you had told me that these kids are so eager to have this done and come in such good moods, and they're not frightened like kids you see here in the States.
No, they're really not. It's wonderful to see how trusting they are. And I think they just haven't been sensitized to doctors. They haven't seen them. They don't have any reason to fear.